are now on the video record. Today, September 17th, 2013. The time is 5:12 p.m. This is the matter of the Circuit Court of the 12th Judicial Circuit in and for Sarasota County, Florida. Danette Griffith, plaintiff, versus Roy L. Baptiste, defendant. Today's deposition is with Eric S. Herman, MD. Counsel, please introduce yourselves for the record, and then we will swear in the witness.
My name is Matt Powell, and I represent Danette Griffith.
Nat Fisher, representing Roy Baptiste.
Can you raise your right hand, please? Do you solemnly swear or affirm the testimony about to give you the truth, the whole truth, and nothing but the truth?
I do.
Okay. Good afternoon, Doctor. We had the opportunity to speak a little bit before your deposition today. I represent Mr. Baptiste, and I'm going to start off your deposition by asking you some questions. You do have in front of you the medical records from your visits with Danette Griffith, correct?
Yes.
All right. And what I'd like to do also is just start off by asking you some questions about your background in education and what sort of doctor are you?
My specialty is called physical medicine and rehabilitation.
Okay. And describe to the jury what sort of practice that is, sir.
Well, physical medicine essentially is the diagnosis and treatment of musculoskeletal problems, which means I take care of non-surgical orthopedic type of problems, aches and pains, a lot of neck and back problems, pains in the joints, nerve and muscle diseases, things of that nature.
Okay. And you have a medical degree?
I do. I'm an MD.
All right. And when did you get your medical degree, from where?
I graduated in 1993 from Southern Illinois University School of Medicine.
All right. And are you board certified?
I am.
All right. And what are you board certified in?
I'm board certified in physical medicine and rehabilitation by the American Board of Physical Medicine and Rehabilitation. I'm also board certified in electrodiagnostic medicine by the American Board of Electrodiagnostic Medicine.
All right. Very good. Now, you have a practice here in Sarasota, correct?
Correct.
And you've had the occasion to treat Danette Griffith, correct?
Correct.
And you were asked to examine Danette Griffith by whom?
She was sent to me through the workers' compensation system.
All right. And it's your understanding that Danette Griffith was involved in a motor vehicle accident of June the 6th, 2007?
Yes.
And is it your understanding that she was working at that time?
Yes.
And who was she working for? Do you recall?
I don't recall. I would have to go through the record.
Okay. Well, what we'll do, 'cause it's been several years since you last treated her, correct?
It was 6 years.
Yes. And so why don't we just start off first by going over the records from your first visit with her, and that would have been August the 7th, 2007, correct?
Yes.
And she presented at your offices for a physical examination at that time?
Yes.
And you personally examined her?
Yes.
And when you meet with a patient, you take a history of their complaints, correct?
Yes.
And that would include prior injuries, prior accidents, complaints, etc., correct?
Yes.
Did Danette Griffith give you a history on August the 7th, 2007?
Yes.
What did she tell you?
She, according to my records, we talked about initially her history. She had had a neck injury and fusion in 1999, and the prior injury was due to a different motor vehicle accident. She was actually a pedestrian and hit by a car. She had a prior workers' compensation injury where she tore her Achilles and had surgery for that in 1998. It says that actual surgery was 2 years after the injury. She had another car accident and neck pain in 2003, but then said she recovered from that accident and was stable until the most recent accident, which was the June 8th, 2007 accident. She was a restrained driver, meaning she had her seatbelt on, and a car backed into her. She told me it was caught on the median and was working its way to back off, and she had honked. They didn't hear her, and the other vehicle struck the front of her vehicle. She could drive her car afterwards, and she actually worked for the rest of the day, and she wasn't in any pain that day. The next day, though, she was a little bit sore, and within 2 days, the pain became severe in her neck, mid and low back, and she developed some numbness and tingling in her left arm and leg, and had had pain ever since that. She actually, on my pain diagram, marked 9 out of 10 as the pain intensity level, which means, extremely severe pain. She said that she felt she was getting worse over time. She wasn't sleeping well. She tried treating with a chiropractor, who actually passed away. She noted it was emotionally hard for her, as well as a physical person, as he was one of the only people that had helped her in the past.
Now, let me ask you, she told you that she was an inspector and in sales for Terminix, correctly, at the time of the accident?
That's the next, right.
All right. And she was treating, following the accident of June the 6th, 2007, with a chiropractor, Dr. Dietz, who had passed away?
Correct.
All right. And she's told you that she has had many jobs over the years and had moved from Fort Wayne, Indiana, correct?
That's what my note says, yes.
All right. Now, you take this history and you ask them, well, what's bothering you? What did she tell you was bothering her at the time of the visit, her subjective complaints?
Her chief complaints were neck, mid and low back pain, and numbness or pain in her left arm and left leg.
All right. Did you note whether she had any MRI films with her?
Yes.
And did you actually see the films that day, or did you just read the reports themselves?
Let's see. It says that I only had the reports, not the actual films that day.
All right. And the reports from what you looked at, what were they telling you? Was it of the cervical spine only, or was it cervical
It looks
and
like
lumbar?
I had both, the
Okay.
cervical and lumbar.
What were the reports for the cervical spine that you saw?
The report said there were post-surgical changes at C5 through C7, stable since 2002, moderate disc bulges at C4-5, asymmetric to the left laterally. There were no frank cervical disc herniations noted. Her lumbar spine MRI suggested borderline canal stenosis due to encroachment on the lateral recess, and proximal neuroforamina at L4-5 due to disc bulge, facet, and ligamentum hypertrophy. So essentially she had some arthritis in her low back that was narrowing the openings for the nerves in the spine, and then in the neck she had degenerative changes, and then the old surgical changes in her neck, but no new ruptured discs.
All right. And were there any findings in the reports that there are any new injuries caused by trauma?
There were not those type of findings, no.
Okay. And the findings on the MRIs of the cervical, thoracic, and lumbar were degenerative in nature?
Correct.
All right. Now, she did state to you that she had a past medical history of cervical and lumbar pain, correct?
Correct.
And she had had migraine headaches in the past?
Yes.
And diverticulitis?
Yes.
Okay. Now, at the time of your meeting her August the 7th, 2007, did you ask her what medication she was taking?
I did.
And what did she tell you?
She told me medicines are just stool softeners and Tylenol PM.
All right. Now, why do patients take stool softeners,
Constipation.
right? And what is constipation caused by?
It can be physical. There's many causes for constipation. It could be medication related. It can be stress. It can be their anatomy, and just many causes.
All right. So it can be from taking medication such as narcotics?
That is a cause of constipation.
Now, she told you that she was allergic to morphine, correct?
Correct.
All right. It would be contraindicated for her to be taking morphine today. Would that be correct if she's allergic to it?
If she's truly allergic to morphine, she shouldn't take it, no.
All right. At the time that she saw you in August of 2007, she was smoking a pack of cigarettes a day, as she reported?
Yes,
Okay. Now, you performed a physical examination of her, correct?
I did.
All right. And you got her height. She's 5'8". And at the time, she was 170 pounds, correct?
Yes,
All right. Now, when you were examining her, you note that she was lying on the exam table through most of the history that she gave you, and that it hurt for her to stand and walk. But then what do you find on your physical examination?
I mean, she's capable of walking. She walked around the room without any loss of balance or any major limp or anything of that nature.
Now, when you say she was able to walk around without any major antalgia, what does that mean in layman's terms?
It means a limp.
So she didn't have any noticeable limp or altered gait at that time, correct?
Correct.
Okay. Now, in your report, you write down that it sounds like a relatively low impact with someone reversing into her. Would that be based on what she told you?
Yes. Well, by the way she described the accident.
Okay. And how did she describe the accident from what you see in your records?
That someone backed into her.
Okay. And what about the property damage?
It's a question I ask. I'm not seeing that here. If you can direct me to it.
Yeah, sure. It's page 3, just above number 5.
It says there is not any major damage to her car other than the bumper.
Okay. And she didn't hit her head or lose consciousness, correct?
Correct.
All right. And at the time, what did you recommend for her?
Several things. She had had pain in the mid-back, so I recommended an MRI of the thoracic spine as they looked at the neck and the low back, but not the mid-back. Looks like I'm missing a page on my,
Are you missing number 5?
I'm missing one page of my records. It looks like I had given her some medications, a muscle relaxant.
Is this the page, Doctor? Let me show it. I think you're missing that page.
Oh, I'm good. Yeah, it was. Okay, will you look at that, Doctor?
Yeah.
Thank you, Matt.
Yeah, no problem.
Yes, this is the page I was missing. So let's see. So I gave her, like I said, a muscle relaxant as well. I gave her an anti-inflammatory medication similar to an Advil, a prescription strength medicine called Lodine, a pain reliever called Ultram for the most severe pain. I wanted to use that sparingly. I wanted to see how she also did with physical therapy. I wrote out an order for physical therapy 3 times a week for a month. I released her to sedentary work for 4 hours a day. And like I said, the thoracic, the mid-back MRI.
Okay. And you also, getting to the last page, you had her fill out a McGill-type pain questionnaire.
Yes.
What is that?
It's a survey of an individual's emotional response to pain. There's several words on a sheet of paper, and the person's asked to circle various words that would describe the type of pain they're having. And if a person circles 20 or more words on this list, that's a suggestion that there's an emotional component to the problem more than just a physical, or in addition to the physical.
Okay. And based on what she told you about her chiropractor having recently passed away, did you have any opinions about that?
I mean, she already said she was having emotional reaction to that, so it's
Okay.
not surprising.
Okay. All right. So you presented this report to the workers' compensation people.
Yes,
All right. And then she came back to you and visited you again August the 21st, 2007?
yes.
All right. Did she receive, to your knowledge, any treatment in the interim between August the 7th and August the 21st, 2007? Did she undergo any physical therapy?
I had ordered the therapy. I'm looking at my note here. She had just had her first visit of therapy when she had seen me at that time.
Okay. Now, August the 21st, 2007, you had her in to go over the MRI results of the thoracic spine.
Correct.
And the thoracic spine is the middle part of the back, correct?
Yes.
All right. And what did you tell her that you saw on the MRI film of the thoracic spine?
There are degenerative type of changes, but no ruptured disc or cord lesions. No, there's no problem with the spinal cord or any compression to the nerves in the spine.
Okay. Was there anything shown on the MRI of the thoracic spine that would indicate any sort of traumatic injury?
There was not.
And again, you conducted a physical examination, and what were your findings?
She had good strength in her arms and legs. She had somewhat widespread tenderness when I pressed on her neck and the entire spine, the cervical, thoracic, and lumbar. I thought she was a little less tender on her exam than the prior visit, and she marked 8 to 9 out of 10 on her pain diagram, so a little bit less than when I saw her the first time.
Okay. And what sort of medication was she taking at the time?
Well, I had prescribed those 3 medicines, the Lodine, Robaxin, and Ultram, and it looks like I changed that to Darvocet from the Ultram.
Okay. And what was your assessment for her at that time?
At that time, as far as a diagnosis, I called this myofascial pain.
And what is myofascial pain?
It means soreness and tenderness to the muscles of the body.
Okay. Like what may be referred as sprain strains?
Well, a sprain refers to damage to ligaments that connect one bone to another. A sprain is a strain's actual muscle damage. So myofascial pain, there's not necessarily physical damage that you can see, but it's a soreness, achiness that people can have after injuries. The muscles are just sore.
Sure. Now, your findings don't represent any disc herniations or nerve compressions, correct?
Correct.
And why would that be important if you were to find that?
Well, there are different ramifications. If there's a ruptured disc, the length of time it takes a person to recover will be longer. There can be nerve damage associated. There are different treatment options from different types of medications, surgical options, different types of therapy that can help. So really, knowing the proper diagnosis helps lead you to the proper treatment for the person.
Okay. Now, I see here that she was asking you about epidural injections as a possible treatment. And what are epidural injections?
An epidural refers to the location of the injection. Epidural, the word epi, or the root epi means on top of, and dura refers to the covering of the nerves. So you're putting medicine on top of the nerve coverings. Classically, they're done in the low back or neck. You can also have in the thoracic area, but these shots are done when there's some type of inflammation to the nerves. So people have a sciatica type of pain down the leg, down the arm. You're trying to reduce inflammation, so there should be a cause, a ruptured disc, spinal stenosis, something like that.
All right. And did you have any findings on examination of Danette Griffith on August the 21st, 2007 that would indicate the need for epidural injections?
I didn't think she was a candidate for it at that time.
All right. Now, in your practice, do you conduct epidural injections?
I do lumbar epidural injections for people.
Okay. Now, you note that she should stick with physical therapy and other conservative care, correct?
That was my recommendation.
All right. And just for the benefit of the jury, explain what a person may do generally in physical therapy and what conservative care is.
Conservative care refers to care outside of interventional care. There's conservative and interventional. Interventional would be shots, surgery, something where you're making physical changes to the body. And conservative care are more starting points for treatment. Things like medications, exercises. Physical therapy can involve modalities, which modalities are things like heat, ultrasound, a deep type of heating. There can be traction where there's distraction of different body parts, massage, and then there's therapeutic exercise where there's strengthening of muscles, stretching, things like that to get a person physically fit in reducing their pain.
Excuse me. And at this time of August 21st, 2007, it was your understanding that Danette Griffith was undergoing physical therapy and conservative care?
Yes.
Okay. And she was telling you about NSAID as helping her. What is that?
And that's an NSAID that refers to a non-steroidal anti-inflammatory, and that those medicines are like Advil or Aleve, ibuprofen, naproxen.
Okay. And were those reportedly helping her?
Let's see. It says help. It does say, and the NSAID had helped her, so we continued with it. We talked about potential risks, but she didn't have any side effects.
Okay. Now, at that time, what sort of restrictions did you give her, if any, and report to the workers' compensation folks?
As I said before, 4 hours. I kept her at the 4 hours a day of sedentary work.
Okay. All right. So then we get to your next visit, would be September 24th, 2007, correct?
Correct.
All right. And at that time, she came in to ask you for a refill of her Darvocet?
Yes.
All right. And did you give it to her?
Again, I may be missing a page. I don't know.
Number 6. Do you have it?
Looks like I just had on the assessment plan just a 1. Yeah, I did not have this in this stack. Let's see. I did refill her Darvocet, yes.
Okay, very good. Now, from the time previous in August 21st, 2007, up until September 24th, 2007, about a month of time, she told you that she had been on a cruise, correct?
It looks like she was on vacation, yes.
Well, she told you that she was on a cruise and had felt worse after coming back from the cruise. Do you see that in your records?
I do.
Okay. And she gained 7 pounds on a cruise, and that's
what my note says that, which is pretty typical.
right. Okay, and she was back to physical therapy and had been working 4 hours a day over the last month with Terminix, correct?
Yes.
Okay. Now, on physical examination at that time, what were your findings?
Again, widespread pain in the neck, thoracic, mid-back, and lumbar, the low back.
Now, let me ask you, when you in your report write she has diffuse pain, what does that mean?
And diffuse means widespread.
All right. So what you'll actually
Not just in one place, but throughout the entire back.
okay, and you determine that by palpating, which is
Correct.
touching
Pressing,
her.
yeah, pressing on the muscles, and the person's sore all over.
And
that
they-
I refer to as diffuse.
Okay, and they'll tell you that they're sore at that point where
Correct.
you're touching them.
Correct.
All right. And you state that this is consistent again with myofascial pain that she had in the past, correct?
Yes.
And her strength was a 5 out of 5 in the major muscle groups in the upper and lower extremities. How do you test that?
You ask the person to resist, and you test individual motions of each limb independently to determine their grade of strength. And 5 means full normal strength. It's graded. 4 is there's some weakness, but they can give you a little resistance. 3 is they can move anti-gravity, but when you give some type of resistance, they can't give any type of support back. 2 is slight movement, but not fully anti-gravity. They can move their arm without gravity, but against gravity they can't move it. And then 1 is just very trace movement where you can just see it, but there's no functional motion. And then 0 is no movement at all.
And you found that she had a full strength of 5 out of 5 in both of her arms and both of her legs, correct?
Correct.
And you state that her sensation is intact to pin and touch in the upper and lower extremities. What does that test for?
There's various pathways within the spinal cord that govern different types of sensation, from light touch to pin to vibration sensation. So there's different tests you can do to try to ascertain if there's some type of neurologic damage to a person.
And and those testings were normal, correct?
Correct.
Signifying that you didn't find any neurologic damage, correct?
Correct.
And at that time, September 24th, 2007, her gait is normal.
Correct.
And gait, again, is the way she walks, correct?
Yes.
Okay. And she was able to forward flex, which is bending over, forward,
Yes. She was able to bend at her waist and extend backwards,
and rotate, and
side to side.
lateral bend, and you say actually very well today.
Correct.
So she was she at a normal range of movement at that time?
Yes.
And you state that she seems to have more flexibility than when I saw her last, and that she agreed with you that she has more flexibility since she started the therapy, correct?
Correct.
So does it appear to you, as we're moving along here in time with her treatment, that she's improving through the physical therapy?
Yes.
Okay. And what was your diagnosis at that time?
Cervical, thoracic, and lumbar pain consistent with myofascial pain.
Okay. And I see here you report that the symptoms are somewhat increased, and you think that's probably due to increased activity from her vacation?
Yes.
All right. And you encouraged her to get back into physical therapy again?
Yes.
All right. And you saw her October the 23rd
Yes.
of 2007? And at that time, she reported to you that she was treating with a Dr. Prive?
Prive. Yes.
Prive, excuse me. Yep. And she reported to you that she was at that time having a 65 to 70% improvement?
Yes.
Okay. And she told you that she was having what sounded like epidural steroid injections, but you didn't have any records of his, correct?
Correct.
And she stated to you then that she was substantially better from last Tuesday, and she is already back to feeling close to normal?
That's what my note says.
Okay. Now, she was telling me at that time that she still didn't feel like she could go up and down on ladders or return to her regular job just yet. So it's your understanding from looking at your notes that her job would entail having to get up on a ladder.
That's, yes,
Okay. And she was still undergoing physical therapy?
yes,
And was she coming to you for refills on her Robaxin and Darvocet?
yes,
Okay. And on physical examination, you state that she was less tender than before. Yes?
yes,
Yes, sir, thank you. And she has some soreness in the cervical, thoracic, and lumbar paraspinals. What are paraspinals?
it's the muscles along the side of the spine,
Okay. But they were less than last time, correct?
yes,
And you were finding the same sort of strength in the upper and lower extremities as before?
yes,
And again, her gait was normal, correct?
her, excuse me?
Gait.
Gait was normal, yes,
Okay. Now, what was your diagnosis at that time? Again, was it cervical, thoracic, and lumbar pain improving?
that's my note says, yes,
Okay. And again, you recommended that she continue on with physical therapy, correct?
yes,
And you believe that the physical therapy was improving her?
I did,
All right. Now, in your records from September 24th, 2007, she asked you again about injections, and what did you tell her at that point?
on which date?
September 24th, 2007?
Okay, so we're going back to
Oh.
the prior,
Oh, I'm sorry.
yeah, see, this
There's
is
the,
out of order.
yep, there's that record. Okay,
So
sorry.
This is going back.
Yep, that's why I was messed up. Sorry, doctor.
Well,
So,
at the September 24th, I didn't recommend injections because her pain was so widespread.
right. And so the injections are, when you use these injections, going back to September 24th, are they because the pain is in a localized area?
Correct, and you're targeting a specific part of the body with the injection.
Right. And did you explain to her why you didn't believe that there was not the need for epidural or trigger point injections?
I would have explained why I didn't think it was the medically correct thing to do at the time.
Okay. And she wasn't experiencing any radiculopathy at the time, correct? If you go back to...
Right, it says that there's not a clear radiculopathy.
Yeah. And what is radiculopathy?
That's a sciatica type of pain, pain down the arm or down the leg.
Okay. Now, getting back to September 24th, and I apologize to the jury and to you for skipping here around, but September 24th, 2007, you increased her work to 4 to 8 hours, correct?
Yes,
All right, so at that time you thought she was able to get back to 8 hours worth of work,
yes,
and you said that you didn't think she was quite ready to climb ladders and do the inspection work, correct?
yes,
So it would be more of going back to 8 hours, but sedentary type work?
no ladders.
Yeah. And at that point in time, were you finding her continuing to improve? In
Yes.
September 24th? Okay. And now we can get to October 23rd, 2007. And you treated with her that day, and she reported to you then that she was improving, correct?
So we're going back then, or, I mean, we already talked about October 23rd. We're going to do that again?
What did, Well, on October 23rd, she was reporting 65 to 70% improvement, correct?
Right, that was yes,
And she continued to have the same sort of diffuse pain?
correct.
All right. And essentially, you found the same diagnosis as before and refilled her prescriptions, and she's able to go back to work, correct?
Yes.
All right. Okay, so we now go to November the 20th, 2007,
Yes.
and that was your last treatment date for her, I believe?
Looks like it, yes.
Okay. Now, she reported to you again, and she reported to you that she had no radicular symptoms, correct?
Correct.
All right. And again, that would be any sort of pain, numbness, or tingling going down the arms or the legs, correct?
Yes.
She didn't report that.
Correct.
And she reported to you that she did have a slight neck ache from sleeping wrong the night before.
That's what my note says, yes.
Okay.
Well, she initially said it was from the last night, and then she changed it to a week ago.
Okay. So she was getting the time frame mixed up some there, right?
Correct.
All right. And she reported to you that she has had some thoracic and lumbar aches,
Yes.
but overall she's getting better.
Correct.
And she had been continuing to treat with physical therapy, and
Yes.
she had a few visits left of physical therapy.
Yes.
You noted that she is doing well,
Yes.
and that would have been from what she was reporting to you.
Yes.
She stated to you she's not back to her maximum level of strength yet. That's what she told you, correct?
Correct.
And she told you that she's not trained to do any home exercises at that time, correct?
Yes.
All right. And you noted that from her past notes, they had been working on some home exercise programs, however, correct?
The physical therapy notes said that the therapists were working on home exercise.
Okay. Now, when she's seeing you in the June 8th, 2007 visit, she was taking what sort of medications?
She had been taking the Darvocet and the methocarbamol.
All right. And what is methocarbamol?
It's a muscle
for?
relaxant.
Okay. And you were talking to her about the need for getting off of these medications and going only to Tylenol type medications?
Yes.
All right. And she told you that she's not back on ladders yet, but otherwise going to her job 6 hours a day?
Yes.
Okay. And what did you find on physical examination?
It says that she had normal strength once again in her arms and legs, full range of motion of her neck. Again, in the low back, she could bend forward, extend backwards, rotate, and bend to the side without any major pain. A little soreness in the right neck with palpation in that area. Normal sensation in her arms and legs to touch.
Okay. And what was your diagnosis at that time?
The same as before, myofascial pain syndrome.
In the cervical, thoracic, and lumbar spine, which
Correct.
had improved to that point?
Yes.
And you actually write in your report that she really has made a tremendous recovery.
Yes.
And at that time, she had slight aches and only in the thoracic and lumbar region.
Mm-hmm.
And that the cervical spine pain is related to her recent sleeping incident that she noted to you, correct?
Yes.
Sleeping wrong.
Mm-hmm.
And you didn't believe that the cervical spine pain, that would be the neck,
Mm-hmm.
was related to the accident of June the 6th, 2007, which you call the original issue?
Correct.
Okay. And that was because before it was, you said it was more of a muscle pain when you saw her before, correct?
Right.
And you weren't finding that muscle pain then, right? was a different
It
kind
was a
of pain.
different type of pain.
Right. And you recommended that she go on a home exercise program?
Yes.
And per the therapy notes, it stated she'd already been doing some home exercises and they'd been working with her on that. But she told you that they hadn't done that with her?
Right, I recommended a couple extra visits for the home exercise program. Sorry, repeat your question?
Well, you state per the note she has already been doing home exercise and they have been working on that with her.
Yes.
She told me that they had not done so, which is inconsistent with the notes. Correct?
Yes.
And she had a few visits last of physical therapy to go through, correct?
Yes.
Now, you have number 3 of the,
On my problem list?
yes, on your assessment and plan list.
Yes.
Tell me what were your findings in paragraph 3 there?
Well, I was making a note of some of the inconsistencies with the stories that she was telling me that day from the neck situation. She was changing the time from it happened the night before to a week ago. The visits, the way she described the physical therapy visits to the way the therapist described the visits were very different. So I
And
just
what
made
were
a
your-
mention of that.
And what were your findings at that time, starting from where you state at this point, there's certainly a good sign that she's made a full recovery?
Check to the form.
I'm not sure if I understand the question.
Well, if you look at the paragraph number 3, what's your opinion as of November 20th, 2007 as to her recovery from the June 6, 2007 motor vehicle accident?
Well, at that point, from my assessment, it seemed that she had, it says there's a good sign that she had made a full recovery at that point.
Okay. And at that time, you thought that she was done with the workers' compensation rehabilitation process, correct?
Correct.
And at that time, you set her at what is called MMI, correct?
Yes.
And what is MMI?
It means maximal medical improvement. It means she was at the maximal level that I thought my medical care could take her.
Okay. And you found, what were your opinions as far as the work up there that you did with her up until that time?
Again, I don't know if I
Okay.
understand your question.
Okay. In your report, you state, per her workup, there was no acute disc herniation or major trauma associated with the accident.
Yes.
Okay? And did you give her a permanent impairment rating from this accident of June the 6th, 2007?
Yes, I made that comment because a permanent impairment rating specifically assesses the amount of damage that's done to the body. So since there were no trauma, there wasn't a trauma found with her MRIs, it was a 0% permanent impairment rating.
Okay. And you advised her that she could follow up with you on a PRN basis, which means on an as-needed basis, correct?
Yes.
Okay. And from your perspective at that time, you thought that she was doing well?
I did.
And your personal opinion as far as your examinations and your findings were that she would benefit from home exercise and over-the-counter medications?
Yes.
And she would be able to return to work with no restrictions, correct?
Yes.
And so at that time, she'd be able to climb ladders?
Yes.
All right. And to your understanding of what the work was that she was doing for Terminex, you were saying that she was able to return to work and do her full duties at Terminex, correct?
Yes.
Okay. And she continued to have good strength? Yes?
Yes.
Okay. And being 5 months since the accident, you found that she got back to a good condition of being back to full activity, correct?
Yes.
And it was your opinion that the motor vehicle accident, per her account, was a reasonably low impact accident and did not result in any major new traumas, is that correct?
Correct.
You didn't believe that she required any specialist care at that time, correct?
No other specialist care.
But that's what I meant to say. Now, you had an addendum that apparently you got some therapy notes after the visit and you wrote the report. What were your findings from the therapy notes?
The therapy notes had suggested there were some inconsistencies between visits as far as her effort was concerned. Some days she was more fatigued than others. They had noted improved muscle tone and were working on stabilization exercises. The notes described progressive improvement in tolerance and activity level. Stated she woke with pain in her neck, confirming that story that she had told me, which matched a week ago date. Initially, she had said, that it was the day before, but then she updated to a week ago. So the physical therapy note confirmed that week ago date, and that just confirmed that I didn't think that was related to the work injury. It was something else causing that newer neck pain.
Okay, thank you. So did you visit with her after that?
I don't see that there were any other visits.
Okay. And you gave these reports to the workers' compensation folks?
Yes.
All right. And is it your opinion that the plaintiff, Danette Griffith, returned to a baseline condition after having seen her?
According to my notes, it looks like she did.
Okay. All right. Thank you, Doctor.
Welcome.
Hi, Dr. Herman. My name's Matt Powell, and I represent Ms. Griffith. How many years has it been since you've seen Mrs. Griffith?
Almost 6 years.
Do you recall her?
I really don't.
You don't remember what she looks like?
If I saw a picture, I probably would.
Okay.
The story sounds vaguely familiar, but I mean, in 6 years, I've seen thousands of people, so it's hard to
Sure.
know.
Okay. And you are a physical medicine specialist.
Correct.
All right. And your participation in her care was through the workers' compensation system, correct?
Yes.
In other words, workers' compensation says to her, please go see Dr. Herman.
Yes.
Okay. All right. What was your understanding of her work history and work ethic before she was injured in this motor vehicle crash?
I don't know if I know her work ethic. I don't see that I refer to that in my notes.
Okay. All right. You don't know whether she was a good worker?
I don't think I had that type of input, other than what she would tell me.
Okay. Do you know if she was working 40 hours a week?
I believe she was prior to.
Okay. And she was going up and down ladders into attics and crawling through basements,
Right.
inspecting for termites, I think, right?
Correct.
Okay. That's somewhat of a physical job,
Yes.
carrying the ladders, going up and down. All
Yes.
right. Do you know if she had any pre-existing conditions that affected her health in any way before the motor vehicle crash?
I mean, she had pre-existing conditions. Like I had initially said, she had had a car accident, she had a cervical surgery and a fusion. She had injured her Achilles at one point, so she had some and had surgery. So she did have medical conditions that could affect her physically.
Okay. And for the sake of the jury, can you explain to us what a cervical fusion is?
Well, there are different types. I'm not a surgeon, but there are bony fusions where they put bone grafts in to make the bones kind of stay together so they don't move. Or there are instrumented fusions where they take plates and they put them against the bones and screw the different bones together so they won't move to make the neck more stable.
Okay. And I'm sure you've treated many patients that have had some sort of cervical fusion.
Mm-hmm.
How does that affect their range of motion?
It limits their range of motion to some degree.
Okay. And doctor, does it cause any extra stress on the joints above and below the fusion?
It does.
Can you explain that to the jury? Why does that happen?
Well, it's the areas that are fused can't move. So just the physics of what's involved with the motion in your body, the forces have to go somewhere. So rather than those areas moving, there's just increased forces that are put on the levels above and below. So those levels will wear out quicker than they would if the bones were allowed to take on the normal shocks that they would receive.
All right, thank you. And doctor, would you agree that a person such as Danette Griffith, who has a fusion in their neck, is more easily injured if they're in a motor vehicle crash than someone who doesn't have a fusion?
Potentially, yes.
Okay. And that, have you heard the old saying, a chain is only as strong as its weakest link?
Correct.
Would that apply to Miss Griffith's neck in this situation when she's involved in a trauma?
Well, the question is how weak are you talking about? I don't know if her neck was the weakest link in her body, but certainly she had underlying factors that make her unique in the way she would respond to an injury or accident.
Okay, all right. And when you did examinations of her, she told you about the motor vehicle collision.
Correct.
And what was it, that the car was stuck on a median?
That's what my note says.
And did she explain to you how the driver had rocked the car forward and backward trying to get off the median and couldn't do it, and so he had to gun the car to get off of it?
That's what I remember she had said.
Okay. And were you surprised if she said, look, I didn't feel any pain that day? Is that a common experience from your patients?
It can be. Sometimes people don't feel pain immediately after the accident, but several hours later then start to get stiff and sore.
Okay. And did that seem pretty consistent with the way the next day she had a little problem?
I mean, she did. She had some pain by the next day, and then it worsened over a couple of days, which is not an uncommon story.
Okay. And I think that you mentioned somewhere in your testimony earlier that there was damage to her bumper. Mm-hmm. Would you agree that there's really no correlation in the medical field between property damage and an injury to a patient?
Objective form.
I don't know if that's a true statement. I mean, certainly the forces that are impacted on the vehicles do affect how much damage can occur to the body. So knowing how much damage is done to the car is sort of a generalized way of assessing how much actual stress to the vehicle there was. I mean, if someone's hit very lightly and there's not much damage, they're probably going to suffer a light injury. But if the car was completely totaled, obviously more serious injuries to the body will occur.
Well, is it possible that that's kind of a misconception? Because if the car crumbles, then the metal fatigues, and that takes away the energy from the impact, and the occupant is actually a little safer.
Objective form.
What's wrong with the form?
You're arguing the issue of property damage to him. You're not asking him a question.
Well, I'm asking you, would you agree that cars are designed to absorb energy when they're in a collision, and so if it's totaled, sometimes that's done to sacrifice the car rather than the patient?
Objective form.
I would say that's the way cars are designed, but when it comes to injuries, low impact injuries have much less injury associated than high impact car
Okay.
accidents.
All right. Have you ever taken a class, or do they teach in medical school, that you should look at the car rather than the patient?
No, they don't say that, but in the pathology courses that we're taught, they actually go through the physics of various situations, gunshot wounds, car accidents, and do talk about the forensic pathology and whatnot that is important when looking at how a person's injured.
Did you look at the property damage photographs in this situation?
I didn't.
Okay. Have you ever treated patients in the past who were in a motor vehicle crash that had no property damage and yet they had very serious and debilitating injuries?
Yes.
Okay. So would you agree that there's really not a clean, clear correlation, that the jury shouldn't say just because there's only damage to the bumper that she can't be hurt?
That's a true statement.
Okay, all right, because it's somewhat of an innuendo kind of going on.
Right. It's just another way of
Objective form.
assessing the situation. The more information you have, the more specific you can get to a person's situation.
Okay. There was also some comment about the fact that she smoked a pack of cigarettes. Do you think that affects or has anything to do with her neck and back pain?
There's correlation between smoking and neck and back problems, yes.
Okay. And if she smoked before the motor vehicle crash and didn't change it at all, do you think that has anything to do with it?
People that smoke heal slower. The nicotine itself actually can affect your body's ability to heal itself. So people tend to make slower recoveries. It's definitely associated with treatment issues along the way.
Okay, so is smoking an additional risk factor that she had before she got in the crash, that if she got in a crash, it would make it worse for her?
Correct.
Okay. All right. And Doctor, this is sort of a general summary question. All the care and treatment that you gave her, was that, in your opinion, related directly to the motor vehicle crash?
Yes.
And was it reasonably medically necessary that she get this care and treatment?
Yes.
Okay. I think you mentioned that on your iPad you have some electronic records, which are kind of in a jumbled mess due to the way technology changes and stuff. Does that 136 pages contain the bill?
No.
Would it contain emails between the workers' compensation carrier and your office?
Potentially it could have that. I think my records mainly have the medical portion, but sometimes there can be some communications with our staff and the workers' compensation.
Okay.
I would have to look to see if there are those type of records.
All right. Could you look?
I could.
All right, we'll take a little break and let you look through it. Go off the record?
Want to go off? Sure.
Off the video record at 6:10. We are back on the video record at 6:14.
Dr. Herman, thanks for looking through your chart, and apparently there's no bill in there. But there was, I guess, one email with Zurich with Catherine Adams.
Yes.
Okay. Let me ask you this. Some of the work that Ms. Griffith missed, do you think that was reasonably related to this motor vehicle crash?
Yes.
Okay. And your job as a workers' comp doctor is try to get her back to work as quickly as possible?
It's my job to get her better.
Okay. When they ask you to do an assessment of her, do they ask you to do an assessment of her whole life and her whole body, or really just as a functional capacity of her ability to work, when you say there's no permanent impairment?
The permanent impairment rating is a specific situation in Florida where there's a guidebook that tells us doctors how to actually rate a person. So it's impairment doesn't mean pain; it means physical damage to the body. So when we're assessing that permanent impairment, it is of the whole person.
Okay. Well, let's say a person was hurt on the job and just has a scar. Would that be a permanent impairment?
It would.
Okay.
Is there a rating in our guidebook for that? I don't think so for just a scar. It depends on how probably much of the body and disfiguring it would be.
Okay. It wouldn't affect their ability to work.
Disability is a whole separate. Disability is function. Impairment is just damage to the body.
I see. Okay. All right. And doctor, do you have an opinion within a reasonable degree of medical probability as to whether or not Danette Griffith's pre-existing conditions were aggravated or made worse by the motor vehicle crash?
At the time I was treating her, I don't believe I was treating pre-existing conditions. I was treating myofascial pain that was secondary to the accident.
Okay. All right. So let's talk about myofascial pain. Help me understand this. It's the muscles are having a problem. Is that right?
Well, myofascia refers to the muscles and the connective tissues.
Okay. And so when the connective tissue and the muscles are spasming, how does
I
that?
wouldn't use the term spasming.
Okay. What word do you like to use?
Injured.
Okay. When you've got a muscle that's injured, what's the physical manifestation that you're able to palpate when you touch them?
I mean, you rely on the person's ability to tell you how much pain they're in.
Okay. But do you palpate people's spine?
Yes, and you can feel knots in the muscle. You can feel actual tight portions of the muscle, and then the person tells you if it hurts or not.
Okay. I mean, let me ask you this: when you do a palpation examination of a patient, do you think that's a subjective examination from your perspective or an objective examination?
The palpation itself is objective. You feel the muscle, you feel how tight it is, you feel if there's knots in it, but then you also rely on the subjective amount of pain a person's in. Because you can have knots that are not painful, or you can have painful knots.
Sure.
Which it certainly depends on how you're going to treat it.
And so when you feel a knot in someone's back, what do you just call that a knot in the muscle?
It's called a nodule.
Nodule. Okay. Is that a voluntary type thing that the patient can do consciously, or is that an involuntary type of manifestation of the muscle?
It's involuntary.
Okay. So that's an objective finding.
Correct.
Okay. And if they say it hurts or doesn't hurt, that's purely subjective?
Correct.
Okay. And doctor, what happens when a muscle is in that knot situation for a prolonged period of time?
What happens well, I mean, people can have pain related to that, and there's something called a trigger point where these knots, when you push on them, actually trigger on and bring on the symptoms that the person's having. So these knots can actually cause pain, or people can have knots and have no pain at all, but tight muscles can restrict range of motion, worsen function.
Okay.
So-
And how about on the cellular level? How does that affect the cells of the muscle that are in this knot position? Does it restrict the flow of blood and nutrients, and does it inhibit the discharge of waste?
Well, I mean, that's certainly an area of research to try to sort out exactly what is going on in these muscles. And unfortunately, there's not some type of medication or something specific for myofascial pain that does resolve it, or there's not a blood test for myofascial pain. There's certainly things at cellular levels. If you take biopsies of tissue, there's inflammatory cells and things of that nature. But there's prolonged tight muscles aren't necessarily, unfortunately, something that we have a test for. You know, the classic example is fibromyalgia, where a person has sore muscles in their entire body, and there's not a blood test, and again, you can't see it, but people nonetheless have sore muscles and pain.
And have you made the fibromyalgia diagnosis in your practice,
Sure.
even though there's really no objective tests?
Well, there are objective physical exam tests, but there's not a blood test or biopsy or something to prove it.
Okay. And I guess if you do the physical test and you find the 16 trigger points, then you diagnose it as fibromyalgia.
Tender points. There's a different term for
I'm
that,
sorry.
but that's okay.
Okay.
Right.
But that's how you make the
Sure.
diagnosis.
That's the rheumatologic description of what what establishes the diagnosis for fibromyalgia.
Okay. And you're not suggesting that Ms. Griffith has fibromyalgia?
I did not make that diagnosis, no.
Okay.
Myofascial pain is more of a regional type of description for that type of muscle pain, where fibromyalgia is where a person has that over their entire body, and then there's other associated medical issues that can go with that.
Okay. The fact that someone doesn't have a ruptured or frank herniated disc, that doesn't mean they don't have a permanent injury, does it?
Correct.
Okay. And just because someone's upper and lower muscle strength is a 5/5 doesn't mean they don't have a permanent injury, does it?
No.
Okay. And just because their sensation is intact in their arms and their legs doesn't mean they don't have a permanent injury.
Correct.
And it can have a normal range of motion and still have a permanent injury.
Sure.
Okay. And the fact that she went on a cruise and was a little more active, that seemed to kind of help her a little bit.
I mean, she
Check
said
the
she was feeling
form.
worse afterwards, but I
Okay.
don't know
I think you said she
as
had
far as therapeutic
increased
value.
range of motion.
Cause and effect, I don't know if I would say it was the cruise. You know, it would be hard to know exactly cause and effect there.
Okay, all right. And I think at every visit you saw her, you continued her medication, correct?
Yes.
And you continued her physical therapy, correct?
Yes.
Even on the very last one?
Yes.
Okay. And some days when she came in and saw you, she said, "Hey, doctor, I'm doing better," right?
Yes.
Okay.
Each time she came in and saw me.
All right. And you don't disagree with Dr. Privé's treatment when he gave her the injections to her, do you?
I would disagree probably with the treatment, yes.
Have you seen his records?
I do have some of his records on my notes, yes.
Did you call him up on the phone and say, "Hey, I think what you're doing is like below the standard of care. I think you shouldn't do that"?
It's not, that's a misrepresentation of my opinion.
Oh, well, tell me what it is.
There is certainly, as a physician, there are many ways to treat individual conditions. We don't always agree. Doesn't mean one person's necessarily right and one person's wrong. And unfortunately, when you have two doctors treating a person in two different ways, and a person's getting better, it's impossible to say who's the doctor who's giving the care that's improving the person. You know, she was having these shots. Are the shots getting her better? Is it the physical therapy? Is it the medicine? Is it time and healing? It was not my opinion that the injuries to her body warranted those type of interventions. They may have helped her. They may have not helped the situation. They clearly weren't hurting her. So there wasn't a reason for me to tell him not to do what he's doing. I know Dr. Privé, he's certainly a competent physician, and it was of his opinion that that was the right medical decision, and certainly okay for doctors to disagree with one another. And it's not my position to tell him how to practice, as it's not his to tell me how to practice. We can differ in our opinions.
Okay. Did Ms. Griffith seem to think that Dr. Privé's therapies were beneficial?
Yes.
Okay. Now, when you indicated that Ms. Griffith made a tremendous recovery, that doesn't mean that she was perfectly healed, does it?
No.
She still could have a permanent injury.
Objective form.
At that time, I believe she did not have a permanent injury, that she was back to a baseline level of function.
Okay. Let me ask you this, doctor. Have you ever had a patient that you treated over a long period of time, and they got to what you thought was pretty good, and then suddenly they started to decline and go into, you know, a real serious condition?
I have seen that happen, yes.
Okay. And you haven't seen Ms. Griffith for 6 years, so you don't know what her condition is like today?
Correct.
Okay. You're not offering any opinions today as to how she is, are you?
I do not know how she is today.
Okay. One of the things that I think came up is, you know, the inconsistencies in her story, and it had to do with, I think she told you that her neck bothered her, and she said it was from sleeping, but the inconsistency was whether it was a night ago or a week ago. Is that right?
Correct.
And the other inconsistency was whether she was taught home exercises or whether she wasn't taught home exercises.
Correct.
Are you here today, I mean, telling the jury that you think that she was faking it or malingering in any way?
Not in any way.
Okay. Thank you, doctor. That's all the questions I have. Appreciate your help.
Quick follow-up. Doctor, you're not saying that Danette Griffith was not injured from the accident of June the 6th, 2007, correct?
Check to the form.
I believe I described the injuries that she did suffer from the
Right.
accident.
And the injuries are myofascial pains, which went back to their baseline conditions before the accident, correct?
That's what I believe occurred, yes.
With no permanent injury from the accident, correct?
The last I saw her, I did not believe so.
All right, thank you, sir. That's it.
Thank you,
Off the video record at 6:26.